Hi, I'm Courtney. This is Danielle. Kylie's recording. We're going to show you how we do a complete bed bath. First off, we're going to start by talking to the patient, telling him what we're going to do. Hi, Sue. I'm Courtney. This is Danielle. We're going to give you some oral care and give you a complete bed bath. We're going to go ahead and pull the privacy curtain. At this time, I'm going to make sure I have all of my equipment ready. I have a towel, I have a soft bristled toothbrush, cotton swab, a denture brush, denture cup, emesis basin, and toothpaste. Alright, so I'm just going to lay down a towel here so I can remove your dentures. I'm going to make sure the bed's at working height, and I'm going to raise her head of the bed to 30 degrees. Alright, so I'm going to go ahead and remove your upper dentures. One's out. Make sure being very gentle when you open the jaw. Remove the lowers. I'm now going to wipe off any excess that came out of her mouth. I'm going to raise the side rails, and Sue, I'm going to go ahead and go wash your dentures, or y'all be right back. Now that I'm at the sink, I'm going to lay down my washcloth in the sink, so if they drop, stop. Okay. Now that I've laid my washcloth down, I'm going to use cool water to brush all surfaces of the dentures. Make sure I get the biting surfaces. Outer surfaces. And I would also get the inner. Go ahead and rinse all that off. Place it in my denture cup, and I'm going to do the same to the bottom. Getting all the biting surfaces. Any other surface on the dentures. Rinse that off. Set that in my denture cup and apply a little bit of cool water in it. Ready? Alright, so I washed your dentures. Now I'm going to come back. I'm going to swab out your mouth for you, and we're going to go ahead and put your dentures back in.
Patients with a history of DVT or hypocoagulation disorders with long-term strokes is contradicted. Use circular judgment strokes.
Alright, so I've swabbed out the mouth, and I'm going to start with putting the upper dentures back in.
If the skin is dry, apply lotion.
Alright, we're going to softly open the jaw.
And make sure you put the and the lotion on between your toes. Once done with this leg,
Making sure that it's in place and it has a good suction again. I can now put in the lower.
and repeat on the leg closest to you.
Okay, Sue, I'm going to go ahead and put in your lowers now.
Oh, that was torture.
That feel for ya. Make sure it's okay. Go ahead and wipe off her mouth. Now that I'm done with denture care, I'm going to go ahead and come back into the resident's room. I'm going to wash my hands, apply gloves, and I'm going to offer her to use the bedpan. Hi, Sue. Do you feel like you need to use the bedpan? No, she doesn't need it. So now I'm going to go ahead and I'm going to adjust the room temperature, make sure it's at the correct temperature it needs to be at, and I'm going to arrange all my supplies. Alright, so I'm going to start all my supplies. We're going to change this. Remove. Now that I've arranged all my supplies, they include rags, fresh gloves, warm water, soap, a brush, supplies for nail care, which include a file, nail clippers, and a cuticle stick. I have cotton swabs for the ears, also include a bath blanket, towels, fresh gown, and all of the fresh linen make the occupied bed. Now I'm going to start with, we're going to and remove her gown. Alright, Sue, we're just going to change your blankets on top of you and remove your gown so we can start this bath. While I'm removing these blankets, I just want to make sure I keep her privacy. And I'm going to keep these linens away from my body and put them into the dirty clothes hamper. Then I can remove her socks. Alright, so now we're going to remove your gown. So we're going to have you go ahead and roll towards me. 1, 2, 3. Make sure it's untied. We can go ahead and start removing it from your arm.
Yeah, this is a regular sheet, but I'm doing a draw sheet. Yeah, isn't that a regular sheet? It's a regular freaking sheet, dude. Is it? Yeah. This bath blanket is too thick and it gets all crinkly and awful. You want me to go get Melanie? No. No. Sure?
We're going to go ahead and remove your pillow now.
Just set that
Raise the
down.
head of the bed for you. Now I'm going to start with washing your face and your eyes for you. Using warm water, 1 washcloth, and no soap on the face. Squeeze out all my excess water. Make a mitt. I'm going to start with washing the eye from the inner to outer. Different part of the rag for each swipe of the eye. Alright, so I'm going to go ahead and wash your eyes now.
Put the fitted sheet on and then the draw sheet.
I'm going to go ahead and wash the other side. Inner to outer. And I'm going to wash the rest of your face.
The open nose is at the bottom. Because it can cause skin tears if it's at the top. Good job, Ashley.
Now I'm going to wash the rest of the face, including the neck.
First on the back, so Ashley can raise her side rail. While I lower mine. Now you're gonna turn Mrs. Smith towards Ashley. And fold her leg over.
And behind the ears.
Good job, Mrs. Smith.
I'm going to pat dry the face.
In. Dirty on dirty. And then put this. Okay. Make sure you do not touch your clothes with it.
And now I'm going to swab her ears for her if she'd like them.
Put the rest of the fitted sheet on.
Let Danielle swab one ear for me. I will swab the other. Alright, so we're going to swab your ears. Now we'll do the opposite side for you. Now we're going to start washing her chest.
Alright.
Correction, we're going to start with the arm farthest away from you. This would be Danielle's side.
Alright, Sue, I'm going to expose your arm and put a towel under it to wash your arm. First, I'm going to wash her hands with soap and water. every finger.
Woo!
And the palm's really good.
Ready? Okay. Let's put the gown on, this is fun.
Then I'm gonna rinse it. So I'm gonna rinse your hand.
Betty? Hold on to that.
And then dry it.
Are you gonna be able to cut it?
Cut.
Okay, good, that's good.
Okay. Next, we're gonna do the arm. You have to do it in long
Are you going
strokes.
up to your bath? Okay, good. I'm going to go wash my hands and gather my supplies.
I'm gonna do the, hold on, stomach is not used.
And then I'll go back over.
Make sure to put the leather correct. I think.
Hold her arm up for me.
Alright, so we're just gonna raise your arm so we can wash it.
So then we'll just put, okay, we'll put all the supply here and then you'll just narrate what we got. We have.
No, still gotta keep Mrs. Smith warm.
Lotion, soap,
Make sure you're getting the armpit good. Rinse.
You need this, right? Yeah. Should she have come up? No, because I could suffocate it.
is this open to get to?
No.
And then we'll dry it off.
The fitted sheet to do this. Share the
Alright, now I'll start nail care. You can either soak their fingers in the emesis basin, or you can use a green stick. Is that what it's called? Cuticle stick. First, you would just push back the cuticles.
Look for any problems with skin. And revolution.
You would trim them. And then file. Okay, now we'll cover her back up, and Courtney will do the same thing on the other side.
Now I would repeat the steps on the same side as correction. Now I would wash the arm on the same side as me using the same steps that Danielle used on the opposite side. We're gonna go ahead and start with her chest, under her breast, and her abdomen. Maintaining privacy, we're gonna place a towel on top of her chest while folding down the bath blanket to under her breast so we can wash. Using the washcloth.
Keep wearing that smile. Keep wearing it.
We have washed our hands and then apply gloves. We're going to now raise her
Using
head
soap.
to mid-thigh level.
So I'm gonna start with washing your chest for you. Circular motions, make sure I get all the spots that I didn't get earlier.
Wait, have Renata do it. Let me film and Renata do it, otherwise she's not gonna get credit for her baby.
Go ahead and rinse.
Okay, that's about comfortable for both of us. And, I'm gonna come first and get the bath blanket to set her up. So it can have dignity and comfort.
Put gloves on.
Miss Jones warm,
And pat dry.
so you better go pull back your sheet that applies to that. We're gonna have two bath blankets.
Now we're gonna move
The first
on
bath
to the
blanket we're
breast.
gonna put on the top of her body. On the bottom half, it's just easier to work that way and pull
Making sure that all the skin is intact, looks good. We're gonna continue on to under the
All
breast and
covered,
abdomen.
I'm gonna wash her face.
Make sure I wash all parts of the breast and the
So my
abdomen.
first washcloth, I fold them in fours
Everything looks
so
good,
that
no
I can
reddened
have a
areas.
clean swipe with every bite. And when you're washing
Now I'm
the
gonna
face,
rinse.
it'll come from clean to dirty. So I'll do the first part of the eye. Then I'm gonna flip my rag over.
Now we're doing
it's clean.
the face on the pillow.
The second part of the
Well,
eye.
Ashley was emptying the
I'll
wash
unfold my
basin.
washcloth
But now
and
it
wash
came
the
in.
rest of it.
That happened a long time ago.
And now all dry.
That happened a
I don't
long
remember
time
saying
ago.
it.
It's very important to inquire your patient while you're bathing them. You can talk about certain things like, is the temperature okay? How does that feel? Are you comfortable? Are you warm?
Now would be the time that we're gonna change our water, adjust the temperature, and start on
And
the rest
face
of the
you
body.
never wash with soap.
Ready?
Apply.
Alright, so I'll be right back. I'm gonna go ahead and go change your water.
Be able to get the soap.
Okay, now we're gonna start with the lower half. I'm gonna expose one leg. Place a towel under. And start washing her feet.
We did go and document how Mrs. Smith did during this process. Here's any more skin here, and then I'm gonna dry underneath her armpit. And I'm gonna cover her back up.
Now we're gonna expose the breast
Make sure
area.
you're getting in between the toes.
Again, put soap on the rag.
Put her upright.
And we're gonna just wash under the breast. Stay tight to the breast. The neck. Rinse off the soap.
Rinse.
I always try to move pretty quickly on this part so she doesn't get cold. And dry off as well as
I
the
can't wait to watch
skin at this point. Making sure that underneath the breast is completely dry. You're gonna cover her back up.
And then
As
we'll
we
dry
move
the
down,
foot.
we'll uncover the part of the stomach and wash that.
Alright. We can use long firm strokes since she doesn't have a history of DVTs.
And we'll rinse the stomach off and dry. At this time, I can see she has a couple scrapes. I'll just assess and make sure that everything looks good. The date on the bandage is correct, and it is, so we'll cover her back up.
And we'll rinse.
Then we'll move to the leg. We'll move to this leg, so I'm gonna just uncover this leg and her side off so we can see her toes. So again, like you started with the hand, we're gonna start with. We're gonna start with the side. Wash that with
And then
soap.
we'll dry.
Lift her
How you
leg
doing
up
so
we
far,
can get
Sue?
rid of
Doing
it.
okay? Water's still warm?
It's possible. And then you'll wash the feet.
And you'll remove the towel and cover her back
Bottom
up.
of the feet in between the toes.
Now I would uncover the leg closest to me and perform the same thing that Danielle has on that side. I'm gonna go ahead, raise the side rails, and change the water again. I will be right back, Sue, and change your water.
In between the toes. Wash your back, apply soap.
Alright, Sue, we've changed your water. We're gonna go ahead and come back. We're gonna wash your back for you. Alright, we're gonna have you roll towards Danielle. 1,
Warm my
2,
dump.
3.
But we did the first pedicure already, we should change the water to do with that.
And then change the water to your butt. Dirty water.
We're gonna lay a
Okay.
towel down at her
Whoa.
back.
I'll just,
Now that we have changed the water from the Perry Care, from the front, we're going to roll her over on the
I'll
back.
use soap.
I'm going to wash her back with soap.
Going from the neckline down to the top of the butt.
How does that water feel? Good? Good. I'm gonna rinse her back off,
Go ahead and rinse.
and I'm going to dry it. Would you like lotion on your back?
And dry.
Yes. I'm going to apply lotion on Miss Jones' back. Making sure it's all rubbed in.
Now if she would like, I can put on
And
lotion.
again, I'm going to perform pericure in the back, which you just need
We're
fold
gonna
it.
go ahead and roll her back over. And back towards me, Sue.
I don't think you have to change the water.
We can give a back rub if the patient would like. Going from the inner to the outer with nice round circles. Now we can
Now
go
we're
ahead
at
and
the
roll
soap,
back
we're going
towards
to do
me.
one swipe from the back, from the front to the back. One swipe. And then I'm going to rinse, one swipe
Now we're gonna perform
from the
frontal
top
pericure.
to the back. And then I'll dry that area.
Okay, Sue, we're gonna lift your legs up.
And we'll roll her back over.
Covered.
And we'll apply her new clean gown.
Just gonna slip a towel under ya.
But for now, we're gonna keep the bathroom blanket on her to keep her warm.
Okay, Sue, we're gonna
And we'll
start your
just take the
pericure.
arms through the
Always
sleeve.
start from inner to outer. Separate the labia. Always
And
use
then we
different
can just
parts of
slide
the
the blanket
washcloth.
from the side. Making sure she's warm. Okay, I'm gonna have you help me lift her head and tie the back. One loose knot,
And
easy
rinse.
to pull.
And then you'll pat dry.
And at this point, we're gonna have, the nurse aide come in and change the bed.
Alright, Sue, we're gonna go ahead and lay your legs down. We're gonna roll you back over so I can do your pericure to your back.
Well, we just touched a real person. Right. I'm just take those clothes off.
Alright, let's go ahead and roll towards the now.
Wait a
I'll lay
minute.
down a towel.
After we change the bed, we'll brush it. Or vocalize, like, would you like a toothbrush now or after breakfast? And then she'll say, after breakfast, so we won't have to brush teeth. Alright.
Use mild soap. And start with the
I'm not hitting it.
part towards the middle of them, up the back, from the middle to the outside, doing 3 swipes, different parts of the rag each time. Go ahead and rinse using the same steps. Going from inner, different part of the rag for each swipe. Now I can pat dry.
You ready? Yes. At this point, we're gonna change an occupied bed. So first, I'm going to remove all extra
Alright,
pillows.
Sue, we're gonna go ahead and lay back
At
down
this point, it's
towards
a
me.
good time to take, so you're gonna take this from clean to dirty, not touching the dirty part. Roll and we'll,
Now that we've cleaned all parts of her, we're gonna go ahead and redress her. Alright, Sue, I'm gonna help you get your gown on you.
I'll do your socks.
and then we'll get rid of this dirty comforter. on the outside. And I'll come and attach the other part on there.
Straightening out the gown for
So
you.
that way
now.
it's just easier for her to get it from the other side.
And I can make one simple easy knot to the neck.
And then we're going to roll Mrs. Jones back easily. Now, Miss Jones, you're gonna roll to me. Come on over. Roll to me. You want to grab from behind her thigh and her middle of her back.